Channel 4, the local station. This is Look Local.
Welcome to Look Local. I'm Karen Adams. This is where we feature local businesses and events going on around town. We do that by reminding you if you're looking for something to do or for someone to help, it's always better to look local. This week, you'll meet a woman who credits New Life Bariatric Associates for giving her her life back. We'll speak with her coming up. Plus, CNS Healthcare will be along to tell you about some new clinical trials that you can take part in for anxiety and depression. Plus, Vibrant Life Health Center is offering a way to help you lose weight that promises not to use hormones, leave you hungry, or involve surgery. We're going to find out more about that. But first, we begin with New Life Bariatric Associates. Dr. Sharma is here, and he brought along with him Shannon Little. Thank you both so much for coming in today. Thank you. And Shannon, you are actually one of Dr. Sharma's patients. So quickly, Dr. Sharma, tell us a little bit about what you did in her case.
Oh, I met Shannon about four years back. Mm-hmm. And you can see the pictures, her life, what she was undergoing. And she undergot the whole evaluation and focused on what it takes to be successful after the surgery. Mm-hmm. She got it right, and today she's an entirely different person.
Okay, so you actually had a life-altering event then after the surgery that Dr. Sharma performed on you, and this was just a few years ago?
Yep, just 3 years ago.
Wow, yeah. Amazing. And what procedure did you have exactly?
I had the Roux-en-Y bypass.
Okay. And your weight, I mean, you don't even look like the same person when I look at that. I mean, you just have like a new lease on life, I suppose.
Absolutely. It just gave me a whole new outlook and more adventurous and just opened up so many new avenues for me.
And that's you right there. And what are you doing there? That's amazing. You're running? Is this a...
That was, did the swim portion in a Ironman half triathlon.
Oh my gosh, look at that. And you know, this is one of those types of surgeries that you perform regularly, and you've been doing this for a very long time, Dr. Sharma. And doing the surgery is just part of it, because it's really up to the patient to then continue to follow through with making sure that they're exercising and their lifestyle changes as well, correct?
Exactly,
okay.
Exactly. Shannon could tell what her limitations were before she underwent the procedure, and look at her lifestyle now. I mean, she's amazing what she did.
And I mean, just can you tell us, I mean, for those at home seeing that, how many pounds did you lose?
I lost about 160 pounds. I tell everybody I've literally lost myself.
You lost a whole nother person, right?
Right.
My gosh. Okay, and then what is the secret to keeping it off?
The secret to keeping it off is learning the healthy, balanced lifestyle. I often joke that he operated on my stomach, but he didn't operate on my brain. And not going back into the old habits pre-surgery, developing good exercise, eating habits.
When you think back on how you got yourself in that situation to begin with, had you been a person that was heavy your whole life?
I was not heavy my whole life. It seemed like once I graduated high school and went through the whole college, getting married, had children, it really ballooned up during that time of my life.
I see, okay. And so then I guess to some extent, depression can go along with these types of things. And
right.
In your case?
I wouldn't say a sad person or a depressed person, but the life I've led is nothing compared to why I am now.
Wow. So you feel like, I mean, you got your life back. And you, as the surgeon that performed this, I mean, very gratifying, I'm sure, for you, because not just having a successful procedure, but then really feeling like you've totally made someone's life complete.
Exactly. I mean, we all know the advantages of weight loss surgeries. Your metabolic syndrome goes away, you lose all the excessive pounds, weight, your medication disappears. Your life increases by 11 years, but the most important thing is the quality of life, the impact on surgery on quality of life. She got a tool, a good tool, but what is more important, she is using the tool in the right way. And this is a perfect illustration of change in the lifestyle after the surgery. She is amazing, she inspires me, and very proud of her.
What does your family think, Heather?
They can't keep up with me anymore. My kids, they were They're now 12 and 14, and they look at me sometimes and they say, "Mom, I don't remember you being heavy," you know, but now they're like, "Well, what are we going to do today?" Or, you know, and it's really helped them. Before, my daughter in particular was headed in the same route I was, and now she's turned her weight around. She's slimmed way down, and she makes healthier choices, and it's really benefited her the most.
And that makes sense. And, you know, that's a question I'm wondering. You know, you say your daughter was sort of headed down that path, and by you having this procedure and changing your lifestyle, you really kind of circumvented her from going down that same path. Do you see a genetic proclivity for this type of thing?
Yeah, there is small element of genetic predisposition, but really it's the environment which changes around. Now, she has changed the environment around. She's more active, eating right, doing all sort of right things in life. And the kids and children and the family just follows it. So it benefits everyone.
I heard somebody say one time, what children learn sometimes is not taught, it's caught. So in other words, by setting an example, you may have really helped your daughter as well. And what advice would you have for other people that might be contemplating this type of thing? What would you say to them?
I would say do your research, know the different operations, what their risks and benefits are. I would say do your self-homework. Know that you've got to change your lifestyle. Know that you've got to incorporate exercise. Know that you can't go back to the old ways. The surgery is a tool, and it only lasts a short period of time. It gives you the time frame to get to where you need to go. And then after that, it's up to you to maintain.
And you would concur with that, obviously.
Absolutely, absolutely.
And you get people like kind of in that mindset then even before the surgery begins. I mean, you tell them what's going to happen, but then it's up to them to make sure it keeps going.
One of the fundamentals which we emphasize is the education. Any surgery is a risk, and if you are successful after the surgery, you should take full benefit for the rest of the life. And it's really how well you use that tool, and that's what we teach all our patients and wants them to use it.
All right. Well, listen, thank you both so much for coming in today. And I know you'll be back soon.
Thank you.
And good luck to you. All right. Well, coming up, we're going to take a close look at what a medical trial is and how it can help you see a doctor and get the medicine that you very well may need. This is especially important if you don't have health insurance or if you need specialty care. Plus, Jacksonville's own soccer club, the Jacksonville Armada, will take on the Tampa Bay Rowdies this Saturday night. The action takes place at Everbank Field. The match starts at 3 p.m. For ticket information, you can go to armadafc.com.